Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing the memory-based questions of the exam, that is SGPGI Lucknow Staff Nurse or Nursing Officer exam, which is conducted on 20th June 2022. So it is conducted on 20th June 2022, that means today. So I am discussing the memory-based questions and I have included 33 questions. These are all memory-based questions. So if you are remembering much more questions, you can give that questions or you can type that questions in the comment. So let me start. The first question is yeast is a options: bacteria, parasite, virus, fungi. The correct answer is option D, fungi. Yeast is a fungi. Then the second question: prevention of disease before its occurrence is what type of prevention? Options: primary prevention, secondary prevention, tertiary prevention, nursing interventions. Prevention of disease before its occurrence. So here the correct answer is option A, that is primary prevention. Prevention before its occurrence is known as primary prevention. Then the third question is dengue is a options: bacteria, virus, protozoa, parasite. So here the correct answer is option B, virus. Dengue is a virus. It is a viral disease. Next is fourth question. Loperamide is administered for. Options are headache, vomiting, diarrhea. Loperamide is administered for diarrhea or loose stools. So correct answer is option C, diarrhea. Then question number 5. DPT means diphtheria, pertussis and tetanus. So that was one question. Then another question was the immunoglobulin that crosses the placenta and provide passive immunity. So the correct answer is immunoglobulin G, IgG. The immunoglobulin that cross placenta and provide passive immunity is immunoglobulin G. Now we can move on to the next question, that is number of steps in hand washing technique. Options are 4, 7, 8, 9. Number of steps in hand washing technique. The correct answer is option B, 7. Number of steps in hand washing technique is 7. There are different answers when we are searching because different organizations have given different steps. So that the question, it should be clear which organization or which association is telling the steps. So that should be clear in the question. Then question number 8, which is not associated with oxytocin. Options are lactogenesis, milk ejection, contraction of uterine muscles, contraction of myoepithelial cells. Which is not associated with oxytocin. So here the correct answer is option A, lactogenesis. Prolactin is mainly associated with lactogenesis. So here the reason or the answer which is not associated with oxytocin is lactogenesis. Now question number 9, which is not an analgesic. Options are ketorolac, fentanyl, propofol, then acetaminophen. Ketorolac, fentanyl, propofol and acetaminophen. So here the correct answer is option C, propofol. All others are analgesic, but propofol is given as a sedative and anesthetic. Now question number 10, withhold digoxin if pulse rate is less than. Options are 60, 70, 80, 90. Withhold digoxin if the pulse rate is less than. So correct answer is option A, that is 60. If the pulse rate is less than 60 beats per minute, digoxin should not be given. Then question number 11, most important reason for hospital acquired infection is. Options: poor ventilation, poor hand washing, excess use of antibiotic. So here the correct answer is option B, poor hand washing. Then question number 12, genetic material is transferred from one generation to another through. Options: both messenger DNA and transfer DNA, then messenger DNA, then transfer DNA, Then last option is DNA. So here the correct answer is option D, that is DNA. Through DNA the genetic material is transferred from one generation to another. So correct answer is option D, DNA. Then question number 13. One question was number of chromosomes in human body cells, that is correct answer is 46. Then there was another question, diabetes is related with. So it is related with blood sugar. So there was another question like that, diabetes is concerned with blood sugar. Now question number 15, which is not found in diabetic ketoacidosis. Which is not found in diabetic ketoacidosis. Options are RBS 450 mg per deciliter. Then option B, low anion gap. Option C, low bicarbonate. Option D, positive serum ketones. So question is which is not found in diabetic ketoacidosis or which is not associated with diabetic ketoacidosis. So here the correct answer is option B, that is low anion gap. Okay, in case of diabetic ketoacidosis, anion gap will be high. So the correct answer is low anion gap is the correct answer in this question. Now 16th question, Addison's disease means. Options are increased aldosterone, decreased aldosterone, increased cortisol, decreased cortisol. Addison's disease means. So here the correct answer is in Addison's disease there will be decreased cortisol. So option D is the correct answer. In Addison's disease there is decreased cortisol. In Addison's disease there will be decreased cortisol. Now question number 17, which is not an anti-epileptic drug. Options are lacosamide, lamotrigine, levetiracetam, linezolid. Which is not an anti-epileptic drug. Options lacosamide, lamotrigine, levetiracetam, linezolid. So here the correct answer is option D, that is linezolid. Linezolid is not an anti-epileptic drug. It is an antibiotic. Linezolid is a category of antibiotic which is given for pneumonia and all. So it is not an anti-epileptic drug. All others, that is lacosamide, lamotrigine and levetiracetam, these are all anti-epileptic drugs. Next question is, which carry deoxygenated blood? Options carotid artery, renal artery, pulmonary artery, aorta. Which carry deoxygenated blood? So here the correct answer is option C, that is pulmonary artery. Option C is the correct answer. Pulmonary artery carry deoxygenated blood. We know that all arteries carry oxygenated blood except pulmonary artery. Pulmonary artery is carrying deoxygenated blood. Now next question is question number 19. Peptic ulcer disease is caused by. There was one question related with peptic ulcer disease. So here the correct answer is Helicobacter pylori or H. pylori. So peptic ulcer disease is caused by H. pylori. Now we will move on to the next question. Collar bone. Which bone is known as the collar bone? That was another question. And the correct answer is clavicle. Clavicle is known as the collar bone. Then next is question number 21. Blood passing through urethra is known as. Blood passing through urethra is known as. Options: hematemesis, epistasis, melena, hematuria. Hematemesis, epistasis, melena, hematuria. So what is the correct answer? Option D is the correct answer, that is hematuria. Blood through urethra, hematuria. Then hematemesis, we know it is vomiting the blood. Then epistasis means bleeding through the nose, and melena is related with the stool. So hematuria is blood passing through urethra. Now question number 22. Air bubbles in chest drainage indicates. Options are air embolism, water leakage, air leakage, normal. Air bubbles in chest drainage is indicating what? So here The options are air embolism, water leakage, air leakage, or whether it is considered as normal. So here correct answer is, if there is air bubbles in chest drainage, it is indicating air leakage. Option C is the correct answer, air leakage. Now we will move on to the next question, question number 23. That is, other than axilla and oral site, the other sites for taking temperature are all except. Options: tympanic membrane, groin, rectum, vagina. So axilla, other than axilla and oral site. We know that axilla and oral sites are sites of taking temperature. So what are the other sites other than these two sites? So the question is, the options are tympanic membrane, groin, rectum and vagina. So here correct answer is vagina. So the temperature can be taken through this tympanic membrane is the correct answer. Then groin is right, and also rectal temperature is also taken. So vagina is the exceptional case here. So option D, vagina, is the right answer. I will read the question once more. Other than axilla and oral site, the other sites for taking temperature are all except vagina. That is the correct answer here. Now the question number 24. As per American College of Critical Care Medicine, that is ACCM, and Infectious Disease Society of America, that is IDSA, fever in an ICU patient is. Fever is considered, how is the fever, what temperature is considered as fever in case of ICU, in an ICU patient? That is the question. It is according to American College of Critical Care Medicine, ACCM, and Infectious Disease Society of America. So the correct answer here is, the options are 37 degrees Celsius, 38 degrees Celsius, then 38.3 degrees Celsius and 39 degrees Celsius. So according to this ACCM and IDSA, fever in an ICU patient means if it is 38.3 degrees Celsius. So option C is the correct answer, 38.3 degrees Celsius. Now 25, question number 25. Which element help in blood clotting? Options: sodium, potassium, calcium, phosphorus. Which element help in blood clotting? So correct answer is option C, that is calcium. Calcium help in blood clotting. Option C is the correct answer. Now question number 26. Identify blood group which is incompatible. Identify blood group which is incompatible. So options are A plus donor and AB positive recipient. A positive donor and AB positive recipient. Then AB positive donor and AB positive recipient. O positive donor and O positive recipient. Then B positive donor and B negative recipient. So in these options we have to identify which blood group is incompatible. Options: A positive donor and AB positive recipient, AB positive donor and AB positive recipient, O positive donor and O positive recipient, then B positive donor and B negative recipient. And so here the correct answer is option D, that is B positive donor and B negative recipient. So these blood groups are incompatible, B positive donor and B negative recipient. Then question number 27. Abnormal ABG cause. Options: bradycardia, cyanosis, restlessness and confusion, DVT. Abnormal ABG cause. Options are bradycardia, cyanosis, restlessness and confusion, and DVT is not the option here. Option given here is wrong. The option given here was normal. Normal is the option given here. Bradycardia, cyanosis, restlessness and confusion, then normal. Even if there is abnormal ABG, the patient will be having no symptoms, patient will be remaining as normal. So which is the option here. So the correct answer here is option C, restlessness and confusion. In case of abnormal ABG, there will be restlessness and confusion. Option C is the correct answer. Now question number 28. Withdrawing a treatment and allowing a patient to die is. Options are active euthanasia, passive euthanasia, voluntary euthanasia, practical euthanasia. Withdrawing a treatment and allowing a patient to die is. So here correct answer is option B, that is passive euthanasia. Option B is the correct answer, passive euthanasia. Active euthanasia means killing a patient by active means. That is injecting a patient with some kind of drugs in a lethal dose, with the intention of killing a patient. If you are giving or injecting a medication to the patient, that is known as active euthanasia. But passive euthanasia means intentionally letting a patient to die. That is either by withholding artificial life support or withholding any treatment. So that is withdrawing a withholding or withdrawing a treatment. That is passive euthanasia. So correct answer here is option B, passive euthanasia. Now question number 29. Which is not a resuscitative fluid? RL, DNS, NS, albumin. Which among the following is not a resuscitative fluid? So correct answer is option B, DNS. Option B is the correct answer, DNS. Then question number 30. Which IV fluid is given in shock due to trauma? Options are NS or RL, half NS, then DNS, half DNS. Which IV fluid is given in shock due to trauma? Correct answer is option A, that is NS or RL. Normal saline or ringer lactate is the IV fluid that is given in shock due to trauma. So option A is the correct answer. The next question. PICC. What is the full form of PICC? That was another question. So correct answer is peripherally inserted central catheter. PICC means that is peripherally inserted central catheter, PICC. Then question number 32. For ABG, blood sample is taken from. Correct answer is from artery. For ABG, blood sample is taken from artery. Then question number 33. Immobility due to prolonged bed rest may cause. Options are hyponatremia, hypocalcemia, hypernatremia, deep vein thrombosis. Immobility due to prolonged bed rest may cause. Options are hyponatremia, hypocalcemia, hypernatremia, deep vein thrombosis. Correct answer is option D, deep vein thrombosis. Immobility due to prolonged bed rest may cause deep vein thrombosis. Then question number 34. All are seen in severe preeclampsia except. Options: severe headache, blurred vision, BP 140/90 millimeters of mercury, epigastric pain. So all these clinical manifestations are seen in severe preeclampsia. So here the question is regarding this severe preeclampsia. In severe preeclampsia, all these manifestations are seen except. And the question is except. This is also important. And options are severe headache, blurred vision, then BP 140/90 millimeters of mercury, and epigastric pain. So here the correct answer is option C, that is BP 140/90 millimeters of mercury. Because in case of severe preeclampsia, BP will be 160/110 or higher. So all other features, there will be severe headache will be there, and the cerebral or visual disturbances like blurred vision will be found, and also epigastric pain. The liver enzymes will be elevated and epigastric pain will be seen. But BP 140/90 is related with mild preeclampsia. Here the question is severe preeclampsia. So the BP will be 160/110 or higher. So here the correct answer is option C, BP 140/90 millimeters of mercury. So these are the 33 questions I am uploading in this video related with this SGPGI exam which was conducted today, that is on 20th June 2022. So I hope you all understood and these questions. These are all memory based questions. So if you are remembering much more questions, you can give that questions, or you can type that questions in the comment. So thank you for watching this video.